A few moments ago, the Republican leader here on the floor talked about a concern about rushing to a health care reform debate and bill. Mr. President, I want to assure everyone, no one is rushing to anything. Everyone is working hard to come up with a good, strong health care reform bill that addresses an urgent need here in this country. In fact, last week, President Obama spoke to all the nation about the urgent need to reform the health care system. He spoke about premiums that have doubled over the last decade. He talked about the out-of-pocket costs that have been shooting up by over a third. He talked about deductibles that all of us have seen skyrocket. He talked about the families and the small business owners who have to work harder and harder just to stay afloat. President Obama spoke about the work that has been done to put a health care reform plan together. I sit on the health care committee here in the United States Senate. We spent months having hearings and working through some of the tough, difficult challenges. We spent weeks and hours working through a debate on a health care reform package. We looked at hundreds of amendments, many of them Republican, a lot of them accepted into our health care bill before it passed out. We are working very hard now with the Finance Committee for them to work through the challenging issues and to come up with the solution, as the House is as well. Mr. President, we are working hard to come to a solution with a health care reform plan that protects patient choice, that reins in those costs I just talked about, and provides coverage for millions of Americans who don't have any today. The President of the United States spoke frankly about some of our Republican colleagues who are standing out and speaking out for the status quo. Mr. President, President Obama spoke plainly to Americans about the devastating cost of inaction. The devastating cost of inaction if we do nothing, and what will happen if we maintain that status quo. I'll tell you what will happen if we do nothing. Premiums are going to continue to rise. Benefits will continue to erode. Out-of-pocket costs are going to continue to skyrocket, and more employers will do what I've seen too many in my state have to do, drop coverage for their workers. We talk about 47 million Americans today who don't have coverage at all. That's going to seem like the good old days if we do nothing. Mr. President, despite what some of our colleagues would like us to believe, Americans do want health care reform. They need health care reform desperately, and they're not going to accept another year of talking and bickering and stalling. Mr. President, last month I sent a letter out to families across my home state of Washington asking for their help as we work here very hard to reform the health care system. I told them I wanted to pass a plan that protects existing coverage when it's good, improves it when it's not, reins in costs today, and lowers them long-term and guarantees care for the millions of people who don't have health care today. I asked my constituents to share with me their stories and ideas about how to make this vision a reality. I told them that I know health care is a very personal issue, but I also told them their personal stories have the power to change minds and transform debates. Mr. President, the response I got was overwhelming. I came to the floor here last week several times and shared some of the over 5,000 stories that have now poured into my office from my state. And I underscored the need to fix this broken healthcare system and to do it this year. Mr. President, I come to the floor today to share a few more stories, and I want to talk about a specific aspect of healthcare reform that I've been working very hard on, and that's as we reform this healthcare system, we have a skilled healthcare workforce that's ready to step up and provide the care we need. Mr. President, Judy Allen from Moses Lake, Washington, sent me a story about her son. She told me that he had been diagnosed with cystic fibrosis at the age of 5 and given a 50-50 chance of making it to his 9th birthday. Now, Judy said she and her husband had good insurance. They had good health insurance, but they had to travel over 3 hours to get to a clinic with the resources that her son needed. And Mr. President, they couldn't move close to this facility because moving would force them to switch health care insurance providers, And they knew that if that happened, they would get rejected because of their son's pre-existing condition. Well, sadly, Mr. President, Judy's son died 3 years ago. But the reforms that we are working on will help mothers like Judy across the country. We want to stop insurance companies from spending our premium dollars figuring out ways to exclude people from coverage. And we're going to ensure that nobody will be denied health care coverage even if they have a pre-existing condition. Unfortunately, Mr. President, Judy's story is not unique. Millions of Americans who have insurance today, who have good insurance today, struggle with a broken health care system. They struggle with the skyrocketing costs. They struggle with a complicated system that works for the insurance companies, but it doesn't work for the patients. So I agree with President Obama. We need to reform the health care system this year. And Mr. President, as we work to provide quality, affordable health care coverage to all Americans, we have to make sure there are enough health care professionals to provide that care. You know, we can write and pass a bill that improves the coverage and reins in the costs, but without an educated, accessible system of doctors and nurses and x-ray technicians and physical therapists and other health care professionals, that coverage isn't going to mean much. If we provide health care coverage without the workers, it's like building the schools and not hiring any teachers. So it's common sense, but it makes economic sense as well. Not only does this shortage make it hard to access care even if you have insurance today, it makes it more expensive. That's why we have made a number of investments that are going to create and sustain good-paying jobs and ensure access to care so that Americans stay healthy and productive. Mr. President, we all know today that too few medical students are going into high-demand general care fields. Many students enter specialty fields, in part to pay for the cost of medical school and because they tend to be more lucrative long-term. So the health care bill that we passed out of our Committee on Health Care includes incentives like loan repayment programs, scholarships, and grants to encourage students to go into high-need fields and to work in underserved areas. It invests in education and training and retention efforts, not just for new healthcare workers, but for all of those who are already providing quality care in this country. Because, Mr. President, investments in our healthcare workforce create jobs, they ease the strain on overworked healthcare professionals, and they keep Americans healthy so they can be productive on their jobs. So I'm going to keep working to make sure these investments remain a priority as we move this healthcare reform forward. Now, quickly before I yield the floor, I do want to reiterate the critical need that I talked a minute ago about fixing this healthcare system. And I want to share a story from my home state. Sharon Alexander wrote to me from Steilacoom, Washington, about her battle with brain cancer, the same type of brain cancer that our colleague Senator Kennedy suffers from. Now, Sharon, again, had health insurance. But she wrote and told me that while she was running from doctor to doctor and undergoing radiation treatments, she and her husband had to spend a great deal of time navigating the different co-payments and acceptance policies of all of her doctors. She told me she was lucky she had insurance, but she still had to jump through hoop after hoop to get the care that she needed. She discovered that in our broken healthcare system, high-priced insurance does not guarantee high-quality health care. Mr. President, that's why we need to act. We need to lower the cost of health care. We need to ensure Americans have affordable health care. And in these difficult times, with all of the challenges Americans have, with premiums rising 3 times faster than wages, and every day 14,000 more Americans losing their health insurance, we're not rushing, Mr. President. We're working hard to get this right, and it needs to be done this year.